Welcome back to another one of our videos, especially this video series right here, which we're talking about how to be able to gain more referrals at a skilled nursing facility, nursing home, or a rehab center, whatever you want to call it, right? And so we're in the part 4 of this whole video series. There's 5 videos in this particular series. So if you haven't watched the videos prior to this video, make sure you go back first and watch those videos, before you continue on. But anyways, in this particular video, we're going to be talking about some additional tips that you can to be able to start gaining more referrals at these type of facilities, right? So let me go ahead and suggest it to you guys. And so please pay attention because this is going to be very helpful for you guys to make getting referrals easier and of course increase the chances that you keep on getting more referrals, right? And you guys gain success. So one thing that I suggest, and here's one of my tips, is you want to be able to send that staff member or the liaison or that marketer or you, right? Or your supervisor, or maybe even, like I said, the administrator, the director of nursing of your facility. So when you want to be able to make sure that you have a referral, you should pretty much drop everything that you need to do. If there's a referral, go straight to that facility right away. You need to make sure that within 3 to 4 hours and not more than that, right? One person or representative from your company needs to be at the door of that facility, of that skilled nursing facility, of that rehab unit, in order to be able to receive all the information that is necessary for you to admit a patient, right? And once again, let me start from the beginning. Make sure that a referral made to your agency, right? Make sure that there's that TO, that order to refer the patient to you. What you want to be able to do is once you get there, by you showing that you're responsive, that you are wanting to respond quickly, it's going to be able to show to that facility that you are very interested and your goal is to take care of those patients. You also want to allow yourself to be able to take a variety of different patients. When you go into these skilled nursing facilities, you're hoping to get a lot of Medicare patients because ultimately those are the breadwinners of the home health industry, of the home health agency. But you're going to have to be able to open yourself up to be able to accept other patients as well. For example, you have your Medicaid patients and also you have those private insurances, right? Those other insurances that may be covering some of these patients that are being discharged to home. We're starting to see a large amount of managed care grow all over the United States lately. And managed care has already seen a lot of growth in the East Coast and the West Coast. And lately, it's increasing more and more in the Midwest, in the central states of the United States. So you want to be able to be that person that's going to be able to accept every single type of patient. Even in the beginning, you want to be able to understand that they're going to try you. Some of these facilities are going to try to give you a hard patient. But imagine this, if you're able to show them that you took great care of that hard case, imagine you can go back to that facility and say, look, you guys gave us a hard case. We took great care of them. Imagine what we can do with the average type of patients, that are going to be considered easier, that you're going to begin referring to us. You want to be able to answer the call of the discharge planner. You want them when they call you, that they know you will handle everything for them once they have a referral for home health. That is what you need to do. So make sure that you take a variety of patients. Yes, you will take care of some patients, some wound patients that can be costly for the agency. But what your goal here is to be the number one, the choice to be called, the first in their mind. The last thing that they should be doing here is thinking of other agencies. They're not going to worry because they know that if they refer to you, then they know that they're going to be handled, right? Back in the days, they would have to call 5, 6, 7, maybe 10 agencies before they get somebody to accept that particular payment or payer. If they start understanding that if they call you, you're going to take care of it, then they're going to start relying on you more. Also, when you walk into a facility, when you're marketing your company, one of the first pages of your marketing packet, if not the first page of your marketing packet, should actually mention which kind of insurances or payment structures do you guys actually accept. Remember, the more that you accept, the more that you're going to be able to be the number one person called these facilities, right? To these facilities. I've met so many home health agency marketers and owners that don't take advantage of finding multiple sources of income for their companies. Remember, as a company, just like large companies out there, they don't just rely on one source of income or flow of income. They rely on multiple different sources. They invest and purchase other companies so that they can have actually other sources coming into that organization. It should be the same exact way for your company. You should make sure that you're able to allow your agency to be able to accept multiple payer sources in order to be able to differentiate yourself, in order to be able to better yourself, in order to be able to stand out from the competitions who are only approved by Medicare and that is only accepting Medicare. So many agencies out there are not even approved by Medicaid or even, seek to be approved by Medicaid. And the reason why they do that is because, well, why should I if I'm not going to be accepting Medicaid patients anyways? Well, guess what, guys? You should do something about it because that is the only way that you're going to be able to differentiate yourself, right? You're not going to be able to be getting always all the Medicaid patients, but if you do accept them, right, it's going to make you stand out. That is such an important thing. You'll be surprised. Some of the big reasons why a lot of agencies don't even accept Medicaid patients because they structured their company to only take care of Medicare patients. And so if they take Medicaid patients, they're going to hit a loss. If they take other insurance companies or other patients with other insurances, they're going to take a loss. And that's something is that you should never, ever do. Now let's say, for example, you're currently not accepting any Medicaid patients or other insurances. What you want to be able to do is you want to be able to position yourself in front of that home health agency and say, hey, listen, I understand that we don't accept those things, but guess what? I actually work with several other agencies that accept those type of payers. At any given point, I want to become the choice for you. If you ask me, if I can't accept the patient, you can send me the order for home health, eval and treat. If we can't take care of the patient, trust me, I will find the right agency for you and push that patient all along to there. But that's the main thing for you guys on what you need to do, right? You need to be able to understand that you have to accept multiple different payments. It makes you guys self stand out. Another thing that I want to be able to talk about is that, when we start talking about multiple flows of income, right? So this particular portion is, a lot of home health agencies should only start offering non-medical private duty services as well, because this is another form of income, and you'll be surprised how many referrals you might be getting those as well. And we're starting to see a lot of agencies pretty much do what they call the triple threat, which is they have the medical home health agency, they have a non-medical private duty, and they also have the hospice. And you'd be surprised that these type of agencies are the one that are winning a lot because no matter what, they're the one call of this referral source. They know that the referral source, the social worker, the discharge planner that is going to be referring patients out, all they need to do is call this one agency and they can actually answer everything that they need for that. So those are pretty much some of the tips that I can actually kind of share with you guys on how you guys can stand out and start getting more referrals. Also, like I said, every time that somebody refers somebody to you, always ask for another referral. Always ask, say, hey, is there other patients that we can help? Or if you see a doctor, hey, doctor, thank you so much for the referral. Let me ask this question. Do you think that there's other doctors out there who would probably enjoy the services that we're offering your patients? And then get that name referral, right? Then you can target those. That's how you expand your company. That's how you expand your agency to be able to have success. So now, like I said, this is the fourth video on this video series. We're going to be moving on to the final video, which is video number 5. If you like this video, make sure you subscribe with us, make a comment, hit the bell icon to be notified of any new videos, and always understand that home health marketing is easy when you know what you know.